this is Dr. Rajeev Nirawane, Pediatric Orthopedic Surgeon. Today we are going to have some thought process about fracture clavicle in children, and here with us are Mrs. Sunena. She is going to help us in understanding the fracture clavicle and what experience she had during the kids fracture. So let's do it. Okay. Yes, ma'am. Tell me.
So I am Sunena Vinciani, mother of Durvi Vinciani. My daughter is 3.5 years old, and suddenly one afternoon what happened is she fell down from bed. She was sleeping, and there was a sudden fall. She turned the other way around and fell on the ground. We immediately took her on the bed. I was alone at home, and it was a real panic situation because she was crying continuously and just lying straight on the bed. She was neither moving towards her right hand side nor moving towards her left hand side, and she was continuously crying. तो वो सो भी गई. After that I immediately called my husband, called him back from office, and we were referred to doctor, orthopedic doctor by our pediatrician. We immediately rushed, but unfortunately we could not meet him that day. But an X-ray was done, and we were provided a sling, and after that we came to know her clavicle bone, right side clavicle bone had broken, and it was clearly visible. It was broken into two pieces.
So when you had a look at that X-ray, I think there must be a, you said panic situation, and that must have triggered three, four, many times.
Yes, yes, the night was absolutely. It was a sleepless night. We could not sleep since we had not met a doctor as well, and seeing the bone, broken into two pieces, and we could see that they are not aligned together. They were not in a straight line. Both the bone, like the bone was broken into two, and it was you know upside down. Yeah, it was a displacement. And as usual, since we had time, we had not met the doctor. We researched a lot that it has a clavicle fracture and maybe there is a surgery required to or we spoke to a couple of friends and relatives on how we should proceed. And some people suggested, since the bone is not aligned properly, you may require some rod or some surgery, some sort of thing. So it was a sleepless night, and the next morning when we met the doctor, it was really delightful experience. We were very relaxed after meeting her. He explained us in a very detailed manner on how the bone will be joined.
So when we had a meeting that time, so what I had told you that even though on X-ray the fracture looks that one fragment is lying here, the second fragment is lying here. Children are blessed with healing potential of the bone units. The blood which is accumulated around the fracture, body will deposit calcium in it. Okay, what we call callus formation, and that particular thing binds the bones together. Generally by 3 weeks it becomes sufficient enough, glued up you can say, where you don't need any immobilization. Initial 3 weeks, yes, we need to give a sling, what we call the clavicle brace. Clavicle bone has the function to support when you lift the arm up to take the weight. That's his function. When there is a break, what the child will do, he will resist because he is having pain. They will do all the stuff down, eating, all that stuff, that daily day-to-day activities the child will be able to do, but he will resist from lifting the hand up. Generally by 3 weeks the bone will consolidate and he will be able to lift the hand up. That's where we take the brace out. Right. And the bone which has formed, you get a nodule kind of thing, a big swelling, but that doesn't hurt even if you press. So what was your thought process at that time when you noticed that okay, now the um, bone is showing a sign of lump?
So initially, I think you had already told us in the first meeting itself, that there might be a bump, and slowly as the time passes, it would go off. So after our first meeting, in the next follow-up, when you checked, definitely there was a bump, and I think now it has reduced a lot.
Now it has reduced significantly. Yes. Even today's X-ray, you can see that the bone has very nicely consolidated, and now currently her function wise, what difference you feel?
Absolutely, she's back to the normal pace. She hasn't really tried to do a lot of activities which involve, since it's a rainy season and we now cannot use monkey bars and all. But after 3 weeks, I saw that she was able to do everything that is in her hand position, like in the same horizontal plane. After I think almost a month, she was able to do everything she used to do before.
So now,
Even now, since we have not tried, but confident, she'll be able to do.
so do you
everything
feel
now.
that the fracture has caused any change in her routine? Like what was the status before fracture and now after fracture? There is
Nothing,
no
nothing,
difference. So
no difference
so
at all.
basically, as I said, the children are blessed with healing potential and they do really well, except the initial, maybe 3-4 days. So during that painful episode, what all care you took uh, about her?
Uh, for the first 3-4 days, we made her lie down as much as possible. She used to get up only while eating or going to the washroom, and after 4 days, 5 or 6 days, she was quite comfortable in doing all the activities which are on the same horizontal plane.
So this particular initial 3 to 4 days, they just need pain management.
Correct. So we gave her medicines as you had prescribed,
Yeah.
and
that's what we call tender
actually
loving care.
actually the pain is so much that children actually cannot do anything. That kind of pain is new
But
for
once
them.
the pain settles down, then they
Correct.
usually do all the stuff.
Correct. They can do a lot of things wherein they don't feel the pain.
So the injury was in the month of
It was in the month of, I think, 2 months back.
2 months back. Now 2 months down the line, you don't find any difference in her activities, and I have very clearly told you now the next follow up is after 6 months. That too just to see that everything is fine.
Correct.
Okay. So in a nutshell, what do you want to tell parents that if there is a clavicle fracture, what is your message in a nutshell? If you want to, as a experience, what you want to tell the parents?
So the first thing is you should immediately visit the doctor and get the x-ray done, so that you understand where the fracture has happened. Second step, don't panic at all. When the bone breaks, exactly the first thought that comes to your mind: nut, bolt, surgeries, everything. So instead of getting panic, first calm yourself down, calm the child down, and then just follow what the doctor is saying, because clavicle fracture is, as sir said, it heals down naturally in kids, and as the age grows, it definitely, the healing process is, it takes a little more time, but in kids, since it happens very soon, just assess the child in the pain management, give them the medicines, pain medicines, and whatever the doctor has prescribed, and take care of the kid.
So thank you so much, ma'am, for giving us a insight about this commonest bone fracture, and I hope that after this, whoever who sees this video, I think there should not be any issue, and just don't panic. Thank you so much. Thank you.